Hello, hello, hello. I feel like my lips is real dry, so y'all bear with me. Happy Thursday. Welcome to our live. Welcome, Felicia, into the room. I am super excited for tonight's IG Live. Let me do a little intro for myself while I'm waiting on our guests to get here. So my name is Janisha Mays. I am the owner and founder of Eudaimonia Wellness and Beauty. We are a wellness spa located here in Dallas, Texas, where we specialize in disease prevention and health promotion. The Fibroid Files the Fibroid Room was my inaugural event that I had back in July during Fibroid Awareness Month. And it really took on a life of its own, to be honest. So I knew that there were a lot of women that were suffering with fibroids and menopause and PMDD and endometriosis. But once I started sharing my journey when it came to my own fibroid journey, y'all, it opened up a world that I had no idea existed. And so this is how we got here. So I had a successful myomectomy in February, removing 17 fibroids, grade 2 endometriosis, and 1 ovarian cyst. My amazing doctor who did my surgery will be joining us soon. But with me doing and documenting and sharing my journey, it opened the doors for a lot of women to have these conversations when it came to the things that they have been suffering in silence about. So I say my story created this platform for me to be able to be open, create this space, create this lane for women who have been suffering and just really don't really know what choices and what options they have. And so from that, we created the Regulated Woman from there, because a lot of women don't realize that how we live our lives and the things that we do on a day-to-day basis interferes with how our body responds to the things that are going on with us. So here we are, catch you up to speed. We had an amazing event, like I said, in in July. And so I want to continue on this conversation to be able to share more things with more women about this topic so that we can,
Did you ever connect the Wi-Fi? You ain't connected to Wi-Fi? Because it still ain't reading.
Do they have Wi-Fi? Do they have Wi-Fi?
It's still searching.
Dr. Crable, I'm trying to bring you on. It says accept, and I'm saying accept, but I still see you with the request. So you may have to come out or go out and come back in order for it to connect. So while we wait for Dr. Crable to join back on, I will be moderating this conversation today. And I am excited for the conversation because fibroids and fertility for a lot of women go hand in hand. And a lot of women don't realize their fibroids interfere with their fertility and vice versa. So I want to make sure that we debunk some myths, because there are a lot of women who have had a lot of misinformation when it comes to this topic. And so I want to be sure that we are debunking the myths about the things that are not necessarily true, but also giving you the information on the things that are true. And then at the same time, I want to share information and make sure that you have resources that you all can actually use. Fibroids affect a lot of Black women, Black and brown. And in the experience that I have had with my own journey, and other women sharing their stories, and I don't know if you have seen recently on social media, but more and more women are coming forward and sharing their story and how much misinformation they received when it came to them trying to get the help. Yay, you made it.
And Dr. Jones is coming too. Sorry.
Okay, it's okay. You know,
I'm new to social media.
I know. You see, I sent that message to you to tell you how to get on.
Yes. That's my fault. I'm sorry. So hopefully my people will get back on. I had several people on. So hopefully they can see us now over on your channel, on your
Yes, I'm
Instagram live.
adding Dr. Jones. Yay, we made it.
We figured it out.
Hi. I thought we were on Dr. Crable's live. So I was like, well, she was there, and then I was
I
trying to
know.
join, and then she was gone. I'm like, where you go?
Well, I accepted you too, but it like hers, it didn't pop up. So sorry, y'all. We're gonna get it together. We do have some brain power over here.
We're here. We're here. We're here, and that's all that matters. So I did a little. Luckily, God gifted me with the gift of gab. So therefore, just talked a little bit about it. So, Dr. Jones, I'm super excited to meet you. There's so many people like, hey, I went to her. Hey, I went to her. I hear that so much all the time,
Me
especially from
too.
Dr. Crable. Oh my goodness. Some of
Me
my
too.
clients and so many of Dr. Crable's clients, y'all, it is ridiculous. I stopped referring people to her. I had to ask her, like, girl, you accepted clients because
I asked
so
her as
many
well
people
because
have
I'm
asked.
just like, I think you booked out till January.
Oh
Yes,
man,
yes, you
I
are
just
in
tell
2020.
people that I'm blessed.
You
So
are.
we'll catch up on all the things I've been doing. But I do want to make sure we do some introductions. I
Yes, that's
know
what we're going
everybody
to
knows who Dr. Jones is, the infamous Dr. Jones. I didn't want to do this live with bomb.com. So why don't you introduce yourself, Dr. Jones, and then Denise is gonna help us go through all this too.
Awesome. So I'm Dr. Tiffany Jones. I am a fertility specialist in Dallas, McKinney, and Frisco. And I do all things from freezing eggs to helping people build families from all types of backgrounds. And I'm just so happy to be a part of this conversation today.
I'm excited to have Dr. Jones here. My cousin actually just was one of your patients, so I'm excited about this conversation. And then Dr. Crable, of course, you have to introduce yourself. We have some new people, and so you should just do your introduction as well because why not?
Yeah, Juanita Crable, my OBGYN, and soon to be just a GYN. Sorry to tell y'all that, but eventually I'm going to give up the OB side, just so I can help more women with fibroids and endometriosis. I want to not join her physically, but join her in the fight of helping women overcome their infertility issues. And so that's my mission in life, is to get rid of these fibroids, get rid of this endometriosis as best I can, so I can help more women get pregnant. And so that's where I'm at. Uh, Today was kind of a crazy day. I still do like hysterectomies and things like that too, but a lot of people know me as an advocate for myomectomy over hysterectomy. I'm passionate about this because a lot of times in my office, women will come in and say that they saw 10 other doctors that told them they had to have a hysterectomy. So um, I like the fact that I'm able to offer other options and able to give women hope, right? That's what we're here for, is to give women hope. Women want to have babies, and they want to keep their fertility, and they want to keep the option open. So that's what we're here for. That's what we're here for.
Yes, I know. You've actually been talking about making this transition for a few years now. So I'm excited and sad, but it's okay. We'll still deal. So
We'll
I
work through it.
want to jump into the conversation because I did ask some people like, questions and things like that. So feel free to intersect. Y'all both were very modest in y'all's introductions. I do want to say that. Y'all definitely didn't pop as much as I was going to pop for y'all, but I love the conversation and bringing the two things together because one thing that I hear from a lot of women is their concern when it comes to their women's health is how it's going to impact their fertility. And especially women who have either not have children yet or women who are on the quest to have children. So I would like us to kind of like start there. When it comes to both of y'all's perspective areas, and Dr. Jones, there are questions that a lot of people ask me about, like the whole IVF journey and the overuse of it and all of those things. So I want to kind of talk about, like Dr. Crable, you were saying that you help and give women the strength and the hope for them to be able to have that. So talk a little bit about like the myomectomies because so many women still have no idea that that is even an option for them when it comes to their fibroids.
Yeah, Dr. Jones, you want to start or you want me to start?
I'll let you start.
Okay, so let's just talk about fibroids in general first. What are fibroids? They're tumors that grow in the uterus. They're fibrous tumors. I've taken out fibroids the size of a pinpoint all the way up to the size of a watermelon. And the largest fibroid I've taken out to date was about 10 pounds, just so you know, they can get really big. The largest uterus I've taken out to date was about 30 pounds. Okay. And so fibroids can be really disruptive, not only towards having a baby, but also towards the quality of life that women have. 80% of Black women have fibroids. 70% of white women have fibroids, and all other races are in between. So that's a high percentage of women that are affected by this disease. And I don't think that we speak on it enough, right? That's why I'm trying to get the word out about what fibroids are and how they can be managed. So let's talk a little bit more about removing them or where they're located, right? So there's different locations within the uterus where the fibroids can be located. And depending on where they are is how they affect a woman's ability to become pregnant and to continue to stay pregnant. And so there's three layers to the uterus, right? There is the endometrium, which is the area where when it thickens, that's where the baby implants. There's the myometrium, which is the muscle of the uterus, and they can grow there. But that's what contracts when you're in labor or when you're having your period. And that's what makes you have cramps is the contraction of the myometrium. And then there's something called the serosa, which is the layer of skin that covers the uterus. And they can grow there or off of there. So you can have fibroids in the endometrium, you can have fibroids in the myometrium, or they can grow off of the outside, off the serosa. Usually, if they are what we call pedunculated or on a stalk. If they're small, I'd say less than 5 centimeters, I don't tend to want to remove them. Um, in particular, just depending on the patient's symptoms, how this problem is affecting her life, things like that. But once they get into the muscle and closer to the endometrium where the baby would grow, that's when we start discussing and getting into removing them. And then, too, also depending on the size. Again, we don't just talk about babies only. I also want to make sure that my patients have a great quality of life. We only get one chance to live this life, right? So we want to make sure our quality in that chance is um, more than acceptable. We want to have a good quality of life, right? Who wants to be at work and just sitting there and then all of a sudden look down and there's blood everywhere? Nobody wants to live that way. Who wants to be in pain all the time? And so that's another reason why I remove fibroids. But when we're talking about fertility, size matters, but also location matters. Go ahead, Dr. Jones.
Yeah, so when we're trying to preserve the uterus for whatever reason, there are options that women have to do so. And what you touched upon before is a myomectomy, and a myomectomy will preserve the uterine structures and remove the tumors that shouldn't be there that are causing issues, whether those issues are heavy bleeding, like Dr. Crable said, or impacting fertility. A myomectomy can be performed without any incision. So myself and Dr. Crable perform hysteroscopic myomectomies where you go in through the natural opening of the cervix. So the same way a baby would be born, we can place an instrument there and shave down fibroids that are in that cavity in the womb where a baby would grow that are not allowing an embryo to implant. So a lot of people don't know that you can remove a fibroid without any incisions, and you can go home the same day and go to work the next day, and really change the course of your life, because most of the time heavy bleeding is caused by a submucosal or fibroid in the womb as well. So I think a lot of the times people are really, they have a lot of trepidation about seeing a doctor because they think that they're going to tell them that they're going to have their uterus removed. Because in truth, back in the day, or even unfortunately in some cases still going on today, that's the only option people are being told about. Another form of a myomectomy is making an incision. Dr. Crable does an excellent job in doing them in a minimally invasive way where you make very small incisions, smaller than a pinky. And I have like little 5-year-old hands. So, yeah, they're really, really tiny. And it's aesthetically pleasing. So, you may not even see those incisions. And again, you can go home most of the time, same day, and have a very short course off of work, and you can take out pretty large fibroids that way, but still don't have like a really major surgery and preserve the uterus. And when I say for any reason, even though I'm a fertility specialist, I've come across women who maybe are done having children, but still want that uterus because it means something to them. And for those women, that should be an option for them as well. So for whatever reason, I'm not a person that discourages hysterectomy, because I do feel like you should have every option as a woman, and
Yes.
nobody should look down upon you for the options you choose.
Yep.
But if we don't give you options, then we're not helping you make an informed decision. We're making a decision by withholding options that are reasonable for the care that someone needs.
And that's a really important statement to make, because a lot of women, in my experience, they feel like that is their only option. They feel like, well, I'm at a certain age, or I've been told in the past that these are my only options, but we have relationships with our womb, whether healthy or unhealthy, that a lot of times we have to deal with as well. And for a lot of women, that becomes a stigma for them,
Mhm.
because now you're telling me I have to disrupt a system that was put in place for me to be able to bear children. And so a lot of questions that I get from a lot of women is, if I have these fibroids, will I still be able to conceive or have children, or what would that mean for me to be able to have children?
So I'll take this question. I will say that I am very blessed to have such a large patient population. And I would say that probably 60 to 70% of my patients have fibroids in some form or fashion. A large majority of my patients never have to do any surgeries to get pregnant, to have those fibroids removed, because the literature will say, by and large, that the fibroids that cause the most problems are the ones that are in the womb. So, and that's like in the place where the baby would grow. So, in the hollow cavity, I always think about the uterus as like an avocado. Where the seed is where the place where a fibroid should not be, because they will cause the most problems with disruption, or even lead to miscarriages if they don't allow the placenta to fully implant where it needs to be. So many women have fibroids, as Dr. Crable pointed out, but not all women have fibroids as a cause for infertility. So I think that's one thing that people should know, that a lot of women have healthy pregnancies without having fibroids removed, and then can have minimally invasive approaches to have them removed if they are a problem.
Yeah, I agree with that. I do have several patients that are pregnant with fibroids. Again, it's not just about the pregnancy. A lot of times, it's quality of life. And what I do see though is if I do have a patient who's had multiple miscarriages or a later pregnancy loss with fibroids, then I would recommend that they have them removed. It's sad that they have to go through that first, and you don't always have to. You always have the option to have them removed. But some women who don't want them removed, I'll say, hey, look, you can try to get pregnant, but if it doesn't work out, then we need to remove the fibroids just to kind of eliminate every possibility as to why you're not getting pregnant or why you're having miscarriages or why you had a late loss.
Mhm.
um, Sometimes late losses with fibroids, or sometimes I'll have women who will get pregnant with their fibroids, and as Dr. Jones stated, they'll get through the pregnancy, but it's kind of a miserable pregnancy, right? They're in the ER a lot. I'm having to admit them for pain control. So sometimes women just want their fibroids removed so they don't have to go through a horrible pregnancy as well. I have a lot of patients that actually can attest to that.
I love that. And that is, I'm glad that you both said that, because that is the number one question I get from women is, what do I do when it comes to having kids? And so I love that we have these conversations and we're being open about this, because women need to know their options. And as you
Mm.
state, whether you decide, whichever route you decide to go, you should be informed and empowered to know that you have options. So for women who do decide they want to have their fibroids done, Dr. Jones, how soon after fibroid treatment should women consider trying to conceive?
Yes, so that's an excellent question, and it really does depend on the way the fibroids are removed. So for a hysteroscopic surgery where we just go in through the natural opening of the uterus and don't make any incisions, any trauma to the underlying myometrium, then I usually allow patients to get pregnant pretty soon after, so within like 1 to 2 periods, because the uterus is always healing. When we menstruate every month, that's a form of shedding and then regeneration. So the uterus is constantly, not all of our organs regenerate, but the uterus, the lining of it, is one of those organs that regenerates every month. But if someone has a more impactful surgery to their myometrium, where there's incisions and having to like kind of repair the uterus, like sew it back together, it takes a while for that strength to come back. So I always say, like, if you cut your hand, right, and then it heals, it has a scar. Well, if you pull at that part that is now has a scar, where do you think it would tear? It's going to tear along the scar, because even though it's healed, it'll never be the same strength as it was before it was injured. And it's the same as the uterus. But what you want to do is you want to give it as much time to heal as possible, because then you have the maximal tensile strengths to withstand something like a baby stretching that uterus out. You know, the uterus starts off like this big and it doesn't end up that way. And so there's going to be a lot of force pulling at those incisions. So most of the time, most of the doctors I work with, we say about 6 months of healing, to really give it the best chance. And absolutely under no circumstances do we typically allow a patient to go through labor. I think that's another point that we struggle with, and I think that's why some patients choose not to have surgery before they get pregnant, because they don't want to have a C-section. But it just is it's really heartbreaking. And I know we've had cases as providers where someone's uterus ruptures, right?
Hmm.
You can grow a baby for 9 months, have a nursery, a name, and everything, and not take your baby home. It's not something I would want any patient to endure. So the risk of that happening late term, with even if someone's in the hospital watching you in labor, it's catastrophic. So
Hmm.
it's really a contraindication once you've had that type of myomectomy to have a birth, a vaginal birth.
Yeah, I agree with her. I usually tell my patients 3 to 6 months, just depending on how much work I had to do on their uterus. You know, obviously, really large, deep fibroids. Remember, there's 3 layers. So the deeper I have to cut into the myometrium, the more likely I am to tell you to wait 6 months before becoming pregnant. Um, Something superficial that's really subserosal, which means that outer skin of the uterus, it's kind of sitting there, then I'll tell them 3 months. Um, I also agree with Dr. Jones about uterine rupture. I recommend my patients have a C-section at 37 weeks. I used to go to 38 until I had my first uterine rupture. And my patient had a momectomy probably a couple years before, and we did everything. I mean, she had big fibroids. We did a good job of closing everything up. We usually do a pretty good job of that. Her uterus looked great, and while she was pregnant, everything looked good. And I'll never forget this story, because when she was about 30 weeks pregnant, I reminded her. I said, "Hey, remember, you have to have your C-section at 37 to 38 weeks," and she wanted to push it more towards the 38 weeks. Anyways, she was a little upset, but we at that moment at 30 weeks we went through the precautions, like, hey, if you feel an abnormal pain in your upper abdomen, you need to come in right away. If you know, if something just doesn't feel right, just come in. And I'll never forget the story. She said she was eating, I think she said at Papados, and after she finished, she felt this weird pain in her upper abdomen. And she just kept thinking, Dr. Crable told me to come in if I feel a weird pain, and I've never felt anything like this before. So she comes in, they try to get baby's heart tones, and they can't find them. And when they went to do her C-section, thank the Lord, the baby was still attached to the placenta, but the baby was floating up near her liver. And
Wow.
I was going to do her C-section. She was scheduled for a C-section that day, but she came in at like midnight or whatever, and had the C-section. Then one of my call partners ended up delivering her, but it was just a really crazy story. So those things do happen. I think what happens, like when you think about things, I'm not going to get off topic too much, but when you think about things like vaccines and other medications that we say people should use, well, we don't really see those diseases, right? So that's how I feel about uterine rupture. Like somebody may say, "Well, oh, it's not going to happen to me." No, we see these things. We see them. Now they're rare, but we do see them happen. That's why we're very cautious to tell you, look, we need to be a stickler about delivering and doing that C-section at 37 weeks. And I get some pushback on it, but that is why, because my patient was very fortunate. She actually called her baby Miracle, because she knew, we told her extent of how much of a miracle it was that he survived that, and that she did as well,
Mhm.
because that could be detrimental to both her and the baby. So anyways, just a little
Yeah.
story. I love telling stories, patient stories. I think it helps people to learn and to know how to navigate their own, because your story, a piece of your story is in the next woman's story, and so on and so forth. It keeps going, right? Everybody, a piece of everybody's story is in there. If you, not to plug the book, but I'm sure y'all have seen my book.
I
um
have it here. I was gonna plug it for you.
that's why I wrote it, because the stories that women can tell about their journey with fibroids, with PCOS, with endometriosis, with fertility, everybody can see a glimpse of themselves in the other women.
And I love that. I raised my hand because I was the person that gave Dr. Crable pushback when it came to having the myomectomy. I didn't want to have the myomectomy because I didn't want the C-section, and that was literally my conversation. I was like, I don't want them,
Right.
and so it did take. I understand. I am a nurse. I get it. So I understood the risk, but at the same time, it's just how me as a woman, you have your own thoughts when it comes to
Right.
your birthing story and how you want your laboring to go. And Dr. Crable's done a great job of reminding me, like, Janisha, it's not about how they get here. We just want to make sure that they're here and safe. And so I am one of those people who have the same thing, because my thoughts is I'm not thinking about the uterine rupture. These are things that y'all
Mm-mm.
see and understand that could be a side effect, unfortunately,
Right.
but we don't see. We're not thinking about that. We're only thinking about, as for me, I'm thinking about my chances and what happens when women go into the hospital and they have their babies, and how the whole climate around Black maternal health is. And so that is our thoughts. And so having the conversation for people to understand why your doctor is giving you these recommendations, it's because they're trying to make sure they can prevent as best as they can to make sure they keep you and baby safe.
Correct.
Absolutely.
Clocked it. Clocked it. So when it comes to like stress, that was the clock definitely for me. But when it comes to like a thing that I hear a lot is how a woman goes day to day when it comes to stress, when it comes to her hormones, when it comes to lifestyle choices, how that intersects when it comes to her fertility and her fibroid health.
Yeah, so just being someone who does, well, me and Dr. Jones treat a lot of fibroids. I do like to try to incorporate the whole woman. So a lot of times after the myomectomy, patients will ask, "Hey, what do I need to do to prevent them from coming back? How can I lessen my chance?" Now, the recurrence of fibroids is high. I don't care how you have them removed. There's a lot of theories out there from a lot of different people on, oh, if it's removed a certain way. No, the same reason you got them the first time is the same reason that they're going to come back potentially. I have had women where I've scanned them after doing a laparoscopic myomectomy with the robot, and they have had zero fibroids, and then 5 years later they have small fibroids again. I mean, it's just, it again, it makes sense because the reason you had them in the first place is the reason they come back. And so we talk about like lifestyle, right? Diet is big. There are different supplements and things that I do recommend for my patient, but diet, I try to tell my patients either to stop eating meat altogether or go towards like a more kosher meat, a meat that doesn't have all the antibiotics and all the hormones in it, because that does affect things. The types of sugars that we eat and starches and the lack of eating vegetables, all that stuff makes a big difference in not only the symptoms of fibroids but how they recur and how quickly they recur. I've had women who have tried to change their diet, go completely vegan or vegetarian to try to reduce their fibroids. Now, I don't really see much improvement in that. It doesn't reduce them, but it can help with the symptoms and the pain and the bleeding. There's a lot more we could go through, like reducing caffeine, like I said, sugar, the types of meat you're eating, taking different supplements. All that stuff does help. Vitamin D. We are very deficient in vitamin D. I know I had my vitamin D checked a couple years ago, and it was like 9,
Mine
which
was
is
7.
horrible. Yours was, oh, you had to
Mine
beat
was
me
I was
then.
like a
11.
corpse. I think I
Yeah,
was
mine was
dead.
11. So I thought I was bad, but I was at 11.
Mine was
Yeah,
7.
yeah, I
I
was like a 9. So that tells you we just don't get as much sun as our counterparts in tanning and all that stuff. And I, like me, I don't drink a lot of milk, and I don't do a whole lot of dairy just because it upsets my stomach, right? So there's a lot of reasons that I have to take my vitamin D supplement every day, right? And my calcium supplements every day. So just looking into that type of thing too. Again, taking care of the whole person. I know I need to do better. I tell my patients all the time, a lot can broach this subject here in a second, but they know I have PCOS. I talk about it a lot. PCOS is polycystic ovarian syndrome. And it makes it difficult for me to be as healthy as I want to be, just because my hormonal imbalance. So anyways, we can get to that subject in a second, but I want to give Dr. Jones a chance to talk on this subject about, health and fertility, because I think it's
Mhm.
important.
Yeah, I would have to just echo what Dr. Crable said about, just different lifestyle changes. I am very cautious though, because when people have fibroids, when you're looking for alternatives to treat them and to shrink them, I haven't really seen anything really show that's occurring. And
No.
I'm never someone that says like, oh, that's not going to work, right? I don't think that the absence of evidence is evidence, but I always say, you can try it, right? As long as it's not, like unhealthy. I know that I was on Clubhouse before and people were like really into like water fast. And people were fasting, like just drinking water for like 14 days. I'm like, well, your fibroids won't be your problem because you will be dead, right? Like this is like, like, so if as long as it's not like something too far off, then you can always try it, and an ultrasound could help, guide and see if this what you're trying is helping you, or if your symptoms are better because what your lifestyle changes. I think those things are helpful, but I will say in the literature we just haven't seen them, reverse in that way. But once you start off with a clean slate after surgery, I definitely think that changing your lifestyle may help the slow the progression, especially things like vitamin D, which are showing some promising links towards fibroids and just the severity of fibroids. And so I don't want to be like a Debbie Downer and say there's nothing you can do, but I also want to be very realistic to patients so they don't feel like, like I don't know. I don't think I could be a vegan. I tried it. It's nasty for me. Like tempeh was like where I got off the bus. And so I was like, nah, I can't do it. But if you do it, it's great. But if you can't do it, I don't want people to think like like they're responsible for this. Some of this is largely genetic. I don't think there's a
Yes.
lot that we can really control, but we can definitely, take control of that disease. But you may not be able to, like it's not your fault that you have fibroids. So I don't want somebody to
Yes.
think that, because I did X, Y, and Z, that's why. Now, mind you, my vitamin D shouldn't have been 7, but, like I got better.
Right. I agree with that. There's a lot of theories out there about what causes fibroids. And the thing, I mean, I've treated thousands and thousands of women with fibroids, and the only common theme I see is hereditary. My aunt, my mom, my grandmother, my sister, my cousin, that's all I ever hear that is a common theme. Now, what can proliferate it or make it worse is the diet, the things we're talking about now. Why do we have worse symptoms? The vitamin D may be one of the causes.
Mhm.
People talk about hair relaxers. That might be a reason why they're worse. But I
Mhm.
honestly, if I had to be real, I tell people this all the time. A lot of my patients that have the worst fibroids, and I don't want to say this, I don't want to be, most of y'all know me. My African patients and my Indian patients are the ones that have the worst fibroids. A
Mhm.
lot of them do not relax their hair. Some do, but I cannot correlate that together. I mean, people apples every day. And I'm like, if I had to really think about who is coming with the worst of the worst fibroids, unfortunately, those are the patients, and I just can't correlate that with relaxers.
Mhm.
Maybe I had to correlate it a little bit with the vitamin D, though. That we may be
Mhm.
onto something with that. Those of you who know me know, or have heard me speak, know that my mother had fibroids really, really terribly, actually. And I think, that's why God placed me in this position to help other women who I can't relate because I don't have them myself. Me and my sister were fortunate. We don't have them, but my mother had them really, really bad to where she's like bleeding down and having like passing out and all kind of stuff. So anyways, I just think those are the things that are exacerbating these problems.
I agree. It is a conversation that comes up a lot. I was a woman who tried to do the same thing. I was like, I'm going to try to shrink them. I'm going to do all the things to help myself to be able to, naturally do it. But it all came down to genetics. Every woman in my family, except for 2 women in my family, have suffered from fibroids in some shape, form, or fashion.
Yeah.
And that's going back to multiple generations. So genetics plays a huge factor in that. But then there are other conditions, and I'm glad you brought that up, Dr. Crable, when it comes to PCOS and women that suffer from endometriosis. How do those things affect their fibroids and their fertility when it comes to battling other things that are on top of the fibroids as well?
Yeah, and I want to say that one of my somebody that I helped remove her fibroids recently just mentioned that there's so many. I'm reading her comment. There's so many scams and supplements and magic teas out there that say they'll help shrink fibroids. So just be careful. There's a lot of people, especially as we keep talking about this more and more, and all these famous people start talking about it more and more. You're going to see more so-called scams. So you bring up a good point. I just wanted to make sure to bring that out. But as far as other problems, I'll tell you this: 80% of the patients I operate on for fibroids have endometriosis, and it's crazy. I did 2 large fibroids today. I took out 2 pretty good size, and one of the girls had stage 4 endometriosis when I did her fibroid. Well, she had a hysterectomy anyways. So when I did the hysterectomy, she had stage 4 endometriosis at the same time. I see that about 80% of the patients that I do in endometriosis, or excuse me, fibroid surgery on. And so it brings me to a point of why I prefer to do my surgeries robotically. Just to say this, no robotic people are telling me to say anything, but it is something I'm passionate about because their technology affords me the ability to see those things while I'm inside the abdomen. They have a camera that is 10 times magnification, and I can really see other diseases while I'm in there taking out fibroids. So most of the time, my patients get 2-for-1 surgery. Okay. I'm not leaving behind any endometriosis when I take out their fibroids because I'm going to do a complete surgery. I'm going to take out the fibroids, and I'm also going to remove as much endometriosis as I can. Now, let's talk about what is endometriosis. So endometrium, we talked about that earlier. That's the lining of the uterus. And that endometriosis is when the lining goes and spreads throughout the pelvis, the abdomen. I even have a patient who has endometriosis in her lungs. The endometriosis can spread throughout the entire body. Okay. It's almost like the C word that we don't like to use, but it doesn't necessarily kill you like the C word does. So it's a very horrible disease, and women suffer tremendously from endometriosis. That is why I'm thankful that I have the ability to treat the endometriosis at the same time that I remove the patient's fibroids. Dr. Jones and I have a lot of patients in common who I've called her in the middle of a surgery. Hey, Dr. Jones, look at this, and I'll show her while I'm doing it. Look at this stage 4 endo. Okay, Juanita, this is what you need to do to help me help her get pregnant, right? She's shaking her head because literally we're able to do that together because we share the same goal. We want to help these patients, and we have helped a lot of patients together become pregnant. So anyway, so endometriosis and fibroids can go hand in hand, but they don't always go hand in hand. The the same thing that's going to feed this endometriosis, which is the hormones. And changing your diet and doing all those things do also helps with the symptoms of endometriosis, but it does not cure the endometriosis. There's really nothing out there that can cure it. Now we can manage it. Even surgery does not cure it because it can return, and it usually does return. Even a hysterectomy is not curative, but it is our best defense against endometriosis when a woman is done with childbearing. Okay, that's really important to understand. I did a hysterectomy on a 26-year-old on Monday because she just did not want to have children. I've had the endometriosis in my patients to the point where they say, Dr. Crable, I've been to 100 doctors. I'm only 28 or 26, but I do not want children. This is affecting my life so bad. I'm depressed and I don't want to live anymore. And when it gets to that point, which it can because it is a very painful disease, then you have to really consider and listen to the patient and together make a decision what's best. But there are medications we can use. Sorry, I'm rambling, but there are medications we can use that shut off the hormones. And people ask me, well, what about my fertility? Dr. Jones is going to use these medications anyways to help
Hmm.
uh, get you ready for a IVF cycle if needed, which sometimes that is needed with endometriosis. Not always, but sometimes it is. And I'm going to let her talk more about we can talk about PC. I skipped over PCOS, but we can talk about that too.
Yeah, so there are a lot of diseases that we see at the same time of fibroids. So endometriosis, PCOS, fibroids can even block fallopian tubes if they're just in the right place at the right time. So for fertility, there can be a lot of ways that it can impede it. But I will say that fibroids, we feel that they grow from, a hormonal imbalance, and so especially my PCOS patients who don't have a lot of progesterone, have a lot of floating estrogen around, I definitely see it in some of them as well. Not all, so there's not 100% correlation there, but it's definitely if there's a fire, one is going to definitely be the gas. And so I would
Yeah.
say PCOS would definitely be some gas to a fire that is the fibroid.
I love that. And I'm glad that we touched on both of those. Like I said in my intro, like Dr. Crable said, it does come both. When I had my fibroids removed, I didn't even know I had endometriosis, had no idea until she told me after the surgery. And so understanding how those things correlate for a lot of women, what would you guys like women to, what type of questions would you like women to ask when it comes to if they're suspecting that they're having fibroids or if they're suspecting that they may be having a fertility issue? What should be their first thing that they either asking or what they should try to do as far as screening and what type of testing they should do?
Well, my personal opinion, I think that we have OB-GYNs have done a poor or a disservice to our patients by not incorporating ultrasounds as part of like routine management or
Hmm.
routine screening, right? So we know that cervical cancer kills people. It's not a large percent of people that get cervical cancer, but it's enough to say that, hey, let's screen people to make sure that we can help those who would otherwise be affected to prevent this very dangerous disease. Mammograms for breast cancer, same thing. Not every woman will get breast cancer, but if you screen, then you can help save a life.
Hmm.
80% of us get fibroids. And I'm just like, well, wait a minute. We not even checking,
That
right?
is
Like you can do a manual exam, but by the time you can feel it, the cat has already jumped out of the bag. So I don't understand. Like, yeah, it may be a little bit more costly. Maybe not everyone has an ultrasound in office. But, as we get more technologically advanced, they make very inexpensive, even wireless options for
Hmm.
ultrasounds, transvaginal or abdominal ultrasounds. So these things can become more accessible. And even though I don't think that every woman has to have surgery for their fibroids just because they're diagnosed, allowing someone to know what's going on in their body will then
Yes.
potentially help them before a fibroid gets to a watermelon, right? If we can, start to say,
Yes.
hey, let's change our lifestyle while you have a little pea-sized fibroid, you may intervene with people having to have lots of surgery. Or there's newer treatments like radio frequency ablation that may be able to minimally invasively treat small fibroids to prevent them from growing
Yeah.
without having to cut into the uterus. So I think we really need to press for changing how we screen women when we're doing annual exams to at least allow them to know early what's going on. Not fear monger to say, oh, you have a fibroid, so you need to have surgery, but hey, you have a fibroid. This is what a fibroid is. This is how we want to monitor it. And that would make more sense to me than what we're doing right now, which is basically when hell is upon you, then let's get an ultrasound. Or wait, no, hell is upon you, put you on birth control pills to see if we can, you know, fix something that we don't even know what it is. And then, oh, that didn't work. Oh, let's now get an ultrasound that could have been done years ago. And now you have a fibroid that's the size of a cantaloupe and you need, invasive procedures or, watchful waiting, but you still have a mass and now you can't even wear a bikini. So I think that would be where I would start, and that would help a lot in preventing even fertility issues because you would get ahead of a lot of this.
You just opened so many doors right now. There's so many things that paths I could go down right now. But I will say one thing is to like feed off of that, not only just to screen. I do a lot of ultrasounds in my office. All my patients know that if you have even I might have a little pain maybe right here, I'm going to send you for an ultrasound. But regardless, I get a lot of times as I'm like a third opinion that I've been having this heavy bleeding for 10 years. I've been having this pain for 10 years and no one's ever just done a simple ultrasound on me, not me, but that's what the
Hmm.
patient says. I've been so that when you said that stuff, I was like, do you know how many times I've sat there and a woman has told me their doctor never even thought to do or we're normalizing certain people's pain, certain people's heavy bleeding. I have patients that come see me with a hemoglobin of 3. That is not normal. Who told you that was normal?
Or safe.
And you just opened a lot of doors for me right now. I'm not gonna go into all of them, but that was a good point.
And I do love that because when a lot of women come and ask those questions, that's my first question I ask. Have you had an ultrasound done? And a lot of
Right.
times, like, so then my follow up question, okay, well, did they do a transvaginal? Because that really makes a difference if they're doing just
Yes.
one that's over the skin versus going in transvaginally, which is through the
Yes.
vagina to have one, because you can see more things. And you're right. Majority of the providers, they're like, and a lot of these people, they be like, no, they ain't even offer me that.
Didn't even offer. And I don't find ultrasound to be a particularly expensive thing. And again, this is not 1975. I mean, it's not that it's not accessible to either have it in an ultrasound, like to have it in your office or to have a partnership with a radiologist and to really just kind of diagnose and to diagnose before we just blanket starting to treat. I don't want people to think I'm anti birth control pills or anything like that. But what I'm anti is just kind of slapping on a fix. And we were all
Blanket.
trained like
Yeah.
this. Like this is what we were trained to put people on birth control
Yep.
pills with heavy bleeding to see if it works. You're having irregular bleeding. Don't diagnose PCOS. Just put you on birth control pills when you're, 16 and see if it works. And it's like, well, maybe getting a diagnosis would just make people more comfortable to understand what they're going to be dealing with. PCOS is not something you can even cure. So if you have that diagnosis, then you may become a vegan at, early in life and then like
Right.
tempeh. I don't know. I didn't. But like it just gives people the information that we are now in a time where that's the demand. It's not an ask, it's a demand for my patients for our patients. They want to know what's going on in their body. And they want to not be told what to do. They want a partnership with a provider who is going to give them the information, give them options, and
Yeah.
then have them, say what's going to be best for them, right? And I'm not going to give, or we're not going to give anybody options that are not options. But
Mhm.
if a patient chooses something that maybe we wouldn't choose for ourselves, that's still that patient's right, and they have the autonomy to do so. But we really have to do better in our training and change our guidelines. And trust me, our guidelines do not put ultrasound in screening. It is not part
Yeah.
of it, and that's something we should probably advocate better for.
I like that. My wheels are churning. Okay, because I love it. Because that is, I don't think, and this is as the nurse practitioner in training, we're not taught that either. It is the guidelines are the guidelines, and those are the things that we're going to go by. And I feel like a lot of the guidelines, I'm like, y'all easily can change the guidelines for high blood pressure, but y'all can't change no guidelines for nothing else. But
And
that's my.
it's 80%. Like, it's not like a little bit. It's not like, oh, like 1 and 5. No, it's like everybody. It's like 2 out of 10 don't.
Right.
So it's like you got fibroids, you got fibroids, you got like, so I don't understand it. And maybe, maybe now that we're in an era where it is more accessible and um obtainable, that will change. But I think it's going to have to start with us providers, because I don't think it should be on the patients to have to fight for everything. Hell, they're anemic and they tired, so we might have to just say, hey, let's make sure. And then we have to fight the insurance companies, because that's the other thing where we could say that we want to do an ultrasound, but if they're not going to
They won't
cover
cover
it
it.
because it's
Yeah.
not part of the guidelines, then now we're in a situation, you're putting someone in a position where they have to pay for something that, their insurance isn't going to pay for it. It's not like an MRI, but it's something, and not
Right.
everyone could potentially afford it. And the people who can't afford it, trust me, they're the ones who need it.
Yep.
Yep.
You're
Yep.
hitting the lot. What y'all do?
Oh, listen, let me say something about my staff that is like all born in like 2020. They talk about the clock it. I'm like, okay, okay, okay. I'm like, I can't deal with this. I need
Yeah,
the people
because I'm
born
old and
in
I don't know none of this
1985.
stuff. Right. I don't
I'm
know
not
any of
young,
this.
it's still new to me. So it's just a different generation. But I do, I was just talking to someone about that, last week, that a lot of the insurance companies, they're not even covering vitamin D testing anymore.
No,
So,
I'll be fully transparent. I do not check for vitamin D. I already know your vitamin D is low. So we
Right.
go on vitamin D, because
Hmm.
I've had patients with $400 bills, $1,000 bills for just checking vitamin D. It is insane. And it's like, like I know your vitamin D is low. So let's go ahead and put you on some supplements. But it's a shame that you have to like, navigate those waters. But I mean, $800 to check your vitamin D, that's insane.
and it's a
I have
$20 test. That's what irritates me.
I have a list of supplements that I put my patients on, especially for PCOS. It's something that I take every day, and
Mhm.
definitely vitamin D is at the top of the list. But I can go through the list really quick. I use, depending on if they're trying to get pregnant. Well, I kind of tell every woman to take myo-inositol
Mhm.
when they have PCOS. But I also use vitamin D, chlorophyll, apple cider vinegar, turmeric. Those are my main ones that I recommend for people to take. And actually, we're seeing some really good results. My patients are, along with the balanced diet and exercise, are
Mhm.
losing weight and they're becoming pregnant on their own. Some of them I have to push a little harder than others, but it's really, I'm seeing a lot of good results. I wish I was at a research place,
Mhm.
because I could do a study on this and see, how many of my patients had success stories after doing those supplements.
So make sure y'all write those down. Okay. Dr. Crable, will you rattle them off one more time?
Yeah, so vitamin D, apple cider vinegar, chlorophyll, turmeric. Did I miss one? Oh,
Mine.
myo-inositol.
Maya Nasatol.
Myo-inositol. Yes. or inositol or Volatile. Some people call it different things, but it's all the same stuff. So yes, highly recommend.
And those are amazing supplements. Those are things that I recommend to a lot of my clients as well, because I get a lot of women that are. I feel like. Do y'all feel like we're seeing PCOS more now
Yes,
than before?
everything.
Okay.
I'm seeing everything more now.
Yeah,
No,
Okay.
I
literally
agree.
since I feel like since COVID, everything is like 10.0.
I
It's
agree.
like way more and more aggressive and more. Like I said, I feel like before when I would do fibroid surgery, I would see maybe 50 to 60% endometriosis. I'm up to about 80%
Oh
endometriosis
wow.
rate on my patients with fibroids. It's
Wow.
crazy. And maybe we're just better at seeing it and treating
I
it,
would, mhm.
but it's who knows the real deal.
So I
So
want
so
to
oh, go ahead,
go ahead.
Anisha. Go ahead. I'm good.
Because I want to get to a couple of questions. And so if you have questions, please drop them below so that I can be sure we ask them. But I did want to kind of close it with a couple of things. Like, if y'all had to give women one piece of advice to take with them tonight about fibroids, about fertility, and what it would be, what would you like them to be left with?
So for me, I always want women to remain very hopeful. I think when we come from a hopeless place, it leaves us very, very downtrodden, very depressed. And there are lots of people in the community that are experts that can help walk someone through and navigate their particular journey. And I also say to remain hopeful, sometimes you have to get more than one opinion, even if you like your doctor, right?
Yeah.
I don't mind people getting multiple opinions when they see me because, like you're just trying to really search what's best for you. So it's not for me. This is not my journey. This is a patient's journey. And making sure like, hey, did they have similar things or they had a different take on it? May help someone feel like I have a path. I have a path forward to pregnancy. I have a path forward to changing my life for the better, to get rid of my anemia, to get rid of my pain, instead of just there's nothing I can do except for a hysterectomy or, there's nothing that I can do at all. No one's listening to me, like you have to remain hopeful and find the people in your community that are going to help fill your cup up because sometimes this can be very, or most of the times I'll say it's very, very draining.
Yeah, so it leads into my advice is to advocate for yourself. And I want to make sure that people know what advocacy is because I think people get confused. So I'm just going to give you an example. If I come to you and I say, hey, Sarah Smith, your blood pressure's high, I need to bring you into, let's say you're pregnant and I need to bring you into the hospital to have your baby. You're, 38 weeks and we don't want to risk getting preeclampsia. Advocacy is not saying, no, I don't want to be induced. I'm going to advocate for myself and say, no, I don't want to be induced. Okay. I want to go naturally and I want to do this thing on my own. That is not advocacy. Advocacy is when you have that high blood pressure at 38 weeks and the doctor sends you home. And then you say, wait, my blood pressure's high. I think I should be put in the hospital. Or I think it's time for me to have my baby. Or maybe I should get another opinion on, I use pregnancy because that's the one I see, where I have to tell patients that's not advocacy more so than any other time. But that's what advocacy is. It's like when people miss your diagnosis or you don't feel like you are getting the right treatment or the right care. That's advocacy. It's not enforcing your desires situation. That's actually harmful. So, but I do recommend that everybody advocate for yourself, advocate for your loved ones. If you know there's a better option, then explore it and at least get the information on it and see if it's the right option for you. And that's what I would leave you with is just advocacy. She already touched on the hope. Y'all know I'm I'm here for hope and healing, but do the advocacy part as well. Don't just like she said, because you love your doctor. That's okay. I want you to love your doctor. That's amazing. But make sure they're telling you. Make sure you have all the information.
And that means you may have to go and see somebody else sometimes, guys. That's okay. So I had a question that was here that I wanted to touch on, and it said, I wonder if being on birth control at an early age and for a long time can cause your body to be lazy, metabolizing your hormones once you get off of that. Thoughts on that?
Yeah, again, I'm not against birth control pills. I think they have a place. I think they've been very helpful in women's health. I don't have any literature to suggest that being on birth control pills, even for a prolonged period of time, would cause someone any harm to their fertility. But what it does do is it masks problems, okay? If I give you something and your body does not have to do it, then how would you ever know that you have irregular periods? How would you ever be diagnosed with PCOS? How would you ever know you had fibroids? Because I've taken away the body's ability to present those symptoms. I am making you have regular periods, right? Which is great, for people because they have regular periods if that's what they want, but then you miss an opportunity to potentially diagnose something early. So when a patient gets off of those birth control pills, especially in my practice, I can see that, oh, now our egg count is lower, right? Which women have to know that we're not going to have eggs for our whole lives. We're not. Men will have sperm until they die, but we will have lower egg counts. And so if you've been on birth control pills for 20 years, the birth control pills didn't make your egg count go low. Father Time did, but you
Hmm.
never had the opportunity to know that you were perimenopausal because you were having regular periods because we were taking those hormones to do it. So I think there's a place for birth control pills. I don't think that they're harmful, but I do think that we have to know that this is not your body naturally doing something. And then to diagnose something, we would have to know what your body is naturally doing. Your body would have to really be in trouble to then now the birth control pills aren't working, right? Now I'm having heavy periods despite those birth control pills because there's something structural like a fibroid that is not allowing that to work anymore. And then we're kind of way down the road where maybe if we hadn't been on them, maybe you would have known something. So it's really a risk benefit ratio, but I don't have any literature to say that the birth control pills is causing this.
I agree. I don't have much to add. I agree. She nailed it.
That was a great question. I mean, that was a great
Really
explanation.
good question.
It was a good question. It was a great explanation. Someone had asked me earlier, question wise, at what point should someone with fibroids consider fertility preservation like egg freezing?
So I want to be very clear about egg freezing. I love egg freezing, okay? But I'm not a person who thinks, or a physician that thinks that every woman needs to freeze their eggs. I do think that every woman should know they can freeze their eggs and it's an option. If you're thinking about freezing eggs, it is best to do it as early as you can with as many eggs as you can. Just like if you go to the grocery store and you looking at something you want to buy, like bread. You don't go buy the bread when it's old. You know how we are. We don't go to getting the stuff in the front of the shelf. You reach to the back of the shelf, okay? I want that new stuff. I don't want the stuff
Yes.
that's about to expire. And when I have women who come to me and they want to freeze their eggs later in life, and later I would say is after the age of 35, it's not that we can't do it, but the quality of those eggs has already started to be impacted. The quantity of those eggs can be
Hmm.
impacted. The number of egg freezing cycles may be change. Like instead of just doing one, which is not an inexpensive thing to do, you may need two or three to get the same amount of eggs. So if, you know, if it's financially feasible, I would say if someone is in their late 20s and early 30s, that would be the best time because those are the best eggs, right? It's like if I was having someone donate eggs, right? We don't typically have people donate eggs after the age of like 32. Even though the eggs are okay after 32, the best eggs are in our 20s. Now, everyone shouldn't freeze eggs at their 20s because you may be, you know, with your partner or having a baby by 32. And so why did I freeze my eggs? So it's a risk, again, a risk benefit analysis for someone. But I would say if you're single at 30, do an analysis and say, okay, well, I'm not even in a relationship. When do I think I'm going to meet this person? And, you know, like I'm still at a great age. I think 30 is a really good age. 35 is an okay age. 38, we can do it, but these eggs aren't going to give you potentially what you need them to give you, which is the only thing is a live birth. The older someone waits, the less likely those eggs are going to work. So if I can impart any wisdom on people, if you have a niece, a daughter, or somebody that is in their early 30s or late 20s, it's not that they have to rush and freeze their eggs. No. But you may want to check your AMH and you may want to start courting that decision so that by before you're 35, you've vetted it, got all the information on it, and then had some kind of life events that you said, if this doesn't happen by this time, I'm going to do this. But starting that process at 42, I mean, we could do it, but I've had patients who do that, and then their eggs, when they try to use them, they don't work, and that's really a travesty. And if they were never told before that time, that's a really big problem.
So you're telling me I can't donate my eggs?
Well, I'm like a politician, okay? I'm not saying that, okay?
I'm joking.
I'm
Don't
not saying that.
want these old eggs,
I'm
Dr.
just
D.
saying you
I'm
can
okay.
donate them. I don't know what they gonna do
I
once
am
you're later.
45 years old. No, thank you. It was just a joke. But no, I think a lot of my patients, I try to tell them, you know, if that's a desire,
Hmm.
they should look into it. I usually use the number 32, but I still tell my older patients it's okay
Yeah,
to at least
absolutely.
go try, get a
Yeah.
workup. And I'm looking at it from a different perspective than Dr. Jones, but I always tell them it never hurts to just go see what your
Hmm.
options and your possibilities are. You know, that doesn't hurt anything. I always say, well, I got to stay PC. I always say, oh, I can send you to Dr. Jones just for a consultation. That's fine. Just go see her for a consultation. Then she can kind of guide you on what your best options are, you know?
Yeah.
So,
And I don't discourage people. Like I don't discourage people from doing it. But if you're asking me when's the best time, I want to be very, very clear and transparent. The best time would be before 35. Because if I spend a lot of money on something, which egg freezing is typically about $6,000 to $8,000, okay? Which is like a Chanel bag, right? My life is based on Chanel, okay? Is it a wallet? Is it a brooch? Is it a bag? Is it a big bag? Okay, so this is a medium-sized Chanel that will appreciate in value, mind you. Okay, so Chanel's not a
yeah.
bad investment. But if I'm
Oh,
gonna
I thought you
spend
meant the
that,
eggs.
huh?
I
No,
thought
no,
you meant the
the
eggs.
Chanel, the eggs are a great investment. But what I'm saying is that if I spend that kind of money, but then later on when I go to use them, they don't work,
Yeah,
then what do I feel about my investment?
right.
Right? It was like, and now we're at a vulnerable stage because now you're starting this process older. So I'm going to say if you're going to anything, like if you invested in your 401k, you start investing early. Let that compound. Get it when they're the best. Don't do it when they're not. Like I see a lot of women like, oh, my AMH is low now, so now I want to freeze my eggs. Well, we can do it, but the best time is to do it like
Yeah.
it's a preemptive thing, right? Like don't
Hmm.
be reactionary to it. It's really doing it at a time where things are the best is likely going to
Yep.
give you the best outcome
Yeah.
if you need it.
I love
Yeah,
it.
very true.
That's a good. Somebody said, Dr. Jones, that you are a master of analogies.
I love them Chanel bags though. Listen, Christmas is coming, okay?
Yeah.
So I'm trying to tell my staff who has gotten on my nerves this whole year that this is what I like, okay? So I'm putting it out there because they in the a little group, okay? So listen. But
Me
I,
and
I
You can
do
put your
Sally.
think,
money, you can put your coins together and get
yeah,
Dr.
together,
Jones a
okay?
Yeah.
Chanel bag.
I guess
But I do feel like analogies really, like if you notice the way Dr. Crable and I speak, like, yeah, we can give you a whole bunch of like $1,000 words and not really reach the audience that we're trying to have a discourse with. I want my patients to understand. So I
Right.
have to be a master of analogies. We have to give you real life scenarios. We want to walk with you. I'm not standing over you telling you what to do. We're not, just like, like the white coat and the, like, and if you don't do that, this is how you lose, especially patients that look like us. This won't fly. We have to connect and we have to talk and we have to meet each other. I have to meet you
Right.
where you are. And so that's why I just make sure that I stay grounded and I make sure that we have these analogies because they make sense. They make sense to just about anybody, right? Now everybody may
Right.
not like Chanel. I don't understand those people, but whatever your poison is, just understand that I do that to make sure that we can really communicate on a level, and I can make sure you're informed.
I love it. Is there any last thoughts y'all would like to leave the audience with? Either it's a myth about something you want to bust for good, or just any last words that you would like to leave everyone with.
I'm just thankful. I'm thankful that for the people who did hop on and took the time to listen to us tonight. This is, a big deal. I want to make sure that we're reaching as many people as we can. That's why Janice and I and Dr. Jones wanted to take our time to hop on here so we can let people know that we really do care. I mean, I had a busy day. I can walk y'all through my day today. It was kind of crazy. And so I'm tired and I want to, go to sleep, but I also want to make sure people know that we care about you and we want to make sure that we are giving you as many options as possible. I'm tired of sitting across from women and with them with tears in their eyes. It's just so like disheartening to me. Again, that is why I wrote the book because I sat across from so many women. I can't even tell y'all. I've cried with some of my patients just because it's sad, right? That when you have to go through these things, and that's why we're here tonight. That's why we're here tonight. And next time we do this, it'll be bigger crowds and bigger crowds because I think people will start to understand that we're doing this to help people. That is our number one goal. I'm already busy. I don't need any more patients. People always ask me that. Do you do these things to get more patients, to get more business? No, I am at capacity, but I want to make sure that we know that we can get help with these problems and that doctors are not bad people. There are people just like you. I am a patient just like time. I'll tell you some of my health stories, but it's important that we know that there are people out there that are advocating for us and that have our best interests at heart. So that's what I want to leave it with.
That is just there's nothing really I can add except for and I'm not paid or any type of uh, anything to gain from this, but I would tell you that I read Dr. Crable's book. I was very I'm very happy that she took time to do it. I think that it is so helpful to women who just feel like they're the only one. And this book really helps people to understand that you're not the only one. And just like she said in the beginning, how our stories are interwoven, it may not be identical, but there are pieces that will resonate and help you know you're not alone, and help you to potentially navigate your own personal journey by understanding what someone else went through. And so I didn't understand how she even did it, because I know how busy she is. Okay. So I was just like, well, wait a minute, champ. This, you do what? Okay. So now I'm looking at myself like, well, wait a minute, what am I doing with my life? Because but it is the dedication to do these things, and the passion to help, that I think will help women who look like us, to women who don't look like us. And so I applaud you for doing it, and I hope
I appreciate it.
women get that book, and it helps a lot of people, and I know it will.
Yes, Dr. Crable, if you could put the link in the chat so that people can, do you have, if you can,
I
like,
will.
okay,
I'll
okay.
put it in there.
So first, I have to appreciate both of y'all and thank both of y'all for taking the time, because I know Dr. Crable's schedule is crazy. Dr. Jones, I'm sure your schedule is just as crazy. And so for you guys to take the time out to have this conversation and be open. There are so many people who feel like they can't have open conversations with their providers because of a stigma that they may have had, or a bad experience that they've had with somebody in the past. But the fact that you both are like, no, like, these are the facts, these are the truths, these are your options, this is what you should do, it really helps so many other women to, I know y'all, I don't know how many DMs y'all get, but I get a lot of DMs about this conversation very often. And so I definitely want to say thank you so much for taking the time to talk with us and have this conversation. And that's first off. This was very eye-opening for me and enlightening as well. I learned something new. And so it reaffirmed some things for me. And so it is important for women to know their options and to know who to go to. So anytime anybody has a question or wants to know which providers, I plug Dr. Crable a lot. Dr. Jones, I'm going to be plugging you too. And so, because I feel like a lot of women who look like me, they need to have providers that look like them when it comes to their type, with their health issues. So, Dr. Crable's book, Voices of Strength and Hope, even if she doesn't put it in, I will put the link in my bio so that you can go and purchase it from Amazon. Because
Working on
it has been an amazing book. She was so amazing to gift the audience at my fibroid room a copy of this book. And so many of the women who have read the book have called me like, Janisha, this was so amazing and it was what I needed. And I don't know how she found the time to do it either, because I asked the same exact question. Like, when did you have time to write this book?
when God places something in your heart or on you, He gives you the time. He gives you. Y'all know me. I'm a very spiritual person. When God puts it in you, when He puts it on you, He makes sure that it's accomplished, right? So that's what I'm going to say. He gave me supernatural energy, supernatural strength and power, and He actually helped me with the right words that I needed to say as well. Because there's 1,000 stories. I'll write 10 more books if I have to, because there's 1,000 stories that I could tell. And Dr. Jones, not to plug this, but I'm trying to work with my girl over here, because we're going to do another one on fertility, because there's so many fertility stories that we can tell together. I want to keep this thing going. We're going to get it together. Don't worry, y'all. It's coming. But that's just it. Hey, y'all heard it here first. Me and Dr. Jones, we're going to put something together to, like I said, keep this momentum going, and to help as many people as we can. These books are not, this is another thing people tell me every time I tell them I wrote a book. I write this book to get rich. Trust me, I'm upside down. Expensive to write a book, but I don't care about that. My goal is to get this word out and to let people know that that they're not alone, and that there is hope and there is healing from fibroids. And in my book, I talk about every single option. I am a surgeon. I love helping people get rid of their fibroids, but at the end of the day, I talk about every single option in that book.
Okay.
Um,
You're on mute, Dr. Crable. Okay.
so
Yes. So I will
I'm
put the
trying to
link.
get the link.
It's even if you can't, I'll add it in my bio. And I'm also going to add the foundation link as well. Dr. Crable, you didn't mention it, but if you want to touch on that, I know you have a lot of other things going on, but it is definitely a mission that I want so many other people to get behind, because people are always asking what they can do to help. And this is the first step that they can do to help somebody else.
Yeah, in actuality, we're still working on the foundation, still trying to get it together. But my goal behind it is for education, not only for patients, but for providers, sensitivity, and really just making sure that we advocate for people. So education is one of the goals. Another goal is to help women with some kind of stipend or something to help cover the cost of their medications or their surgery. A lot of women will see me and they'll want to have surgery because their fibroids are really large, they're bleeding like crazy, and they want the help, but they can't afford their copay or their deductible. So that's one of the goals behind my foundation. But again, this stuff takes a lot of work. You want to make sure you're doing it legit. And so it's all still a work in progress. Those are just a few things that we want to do. There's a lot of foundations out there that offer like pads, and that'll probably eventually be a goal. But coming from someone who's a
Mm-hmm.
fibroids every day, I kind of wanted to do something where I'm helping women afford to have their procedures done. So that's kind of what I'm working towards. I'm not quite there yet.
We're getting there. We're getting there. So how can they connect with y'all? How can they find you? How can they visit y'all in the office? Where y'all located? I can't ask about if y'all taking new patients, but people gonna ask that too. So
I don't think we ever stop seeing new patients, but it is, we're pretty busy, but always here to help. My Instagram is here at T Jones IVFMD. You can actually book appointments through my Instagram for new patients if you so desire. I'm at Conceive Fertility Center. I'm actually in my office here in Frisco right now. I drove from Dallas tonight, and I knew I wasn't gonna make it home in time, so I was like, let me just go to the office and make it here on time. But we'd love to see you. We also have two other wonderful providers, Dr. Escobar and Dr. Haas, who may not look like me, but I will tell you that they care for patients just the same. And
Mhm.
I don't necessarily think a doctor has to look like you, but they have to make you feel like they hear
Hair,
you,
yes.
and they care. And so I'm just so blessed to work with two great providers in that way. And so you can see any of us at Conceive Fertility Center. We'd love to see you. Fibroids, no fibroids, whatever your needs are, we're here for you.
So mine is here, Dr. Juanita Crable on Instagram. My office is at the Margot Perot building in Texas Health, Dallas. And I have a website. It's Dr. Crable, OBGYN.com. So you can go there or just call my office 469-364-3764 and see if we have any appointments available.
I'm
Um,
saying right
always,
now, like
always,
a
but I'm
schedule.
all
So
well.
she's
I'm
booked out a few months.
well, I'm always taking consultations for fibroid treatment. I want to make sure that's clear because that is my mission, right? That's my calling is to be able to treat fibroids. So I'm always taking consultations for fibroid management and treatment. But like a well woman or a new OB, that's a whole different story. Just so you know, you might hear. I do have a nurse practitioner though, and she's amazing.
She's a
Um,
joy.
She really is. Is she not? You met her. You met
I
her. Dr.
did.
Jones randomly met her on a cruise. And I waited, just to plug her too. I waited I've been here almost 15 years, and I've been by myself this whole time. I've never hired anyone because it's really important to me to have the right fit. Finally, my little piece of joy came along, and she is definitely the right fit for my office. She's amazing. I know a lot of my long-term patients want to see me. I get it. Your doctor is out here trying to world. And so, but Joy is so amazing. She's just a great personality. And so I want to make sure you guys understand I'm not leaving you in bad hands if I'm not available. I'm traveling all over the country, teaching, proctoring. I do a course twice a quarter. I'm doing everything I possibly can do to get the word out about options for fibroids. So just know that that's what I'm doing. I'm on a mission. I'm not out playing. Well, I don't play golf, but I'm not out playing golf somewhere. That's kind of what we say.
Mahjong.
I'm not out playing mahjong somewhere. I'm actually trying to continue to get this word out and help as many people across this country. Because one thing too, a lot of patients were flying in to see me from all over the country and actually from all over the world to have their fibroids removed. And so now my mission is to go out and teach as many people in these cities so that these patients can stay at home when they have their surgery. So that's really important too. Anyways, that's a whole nother topic. But I do want people to understand what we're doing and why it's so crazy and hectic. And I might have to reschedule your appointment because they're calling me to come teach somebody something. So that's what I've been doing.
Well, yes, I agree with Jenny. It is worth the wait. However you get in, but it is worth the wait. Y'all are both amazing providers at what y'all do. And I am honored to be able to have this conversation and share the fibroid files. That's how all this came about, was just me sharing my own personal story and my own journey when it came to my fibroid health and what I was doing. And so I feel like, just like Dr. Crable, we need to have more education. We need to have more providers that know what to do or who to turn to and learn more. Now, I am ecstatic to see the change in providers that is happening across the world. And so for more providers to get the knowledge, get the education, get the training, get the teaching so that they can help more women is definitely going to be necessary. So you can connect with both Dr. Jones and Dr. Crable here on IG. I will put the book for Dr. Crable's book, the link in my bio so that you can purchase it from Amazon. No worries. Janisha's here to save the day.
Thank you, Janisha. I'm just really bad at anything technology wise. I'm working on it. I'm
It's
going to take
okay.
my own course to
It's
figure
okay.
out how to be
You know the
savvy.
technology that we need you to know, and that's the robotics. So everything else we can work around.
But it is available on Amazon. You
And
can
it's
Amazon
available.
and Voices of Strength and Hope. Go on there.
You can. People like to have a link.
It's on my Instagram too. I have a link on my Instagram. So
You can find it there. You can find it on their pages, and the conversations will continue on. The fight will continue on. I appreciate both of y'all. Dr. Jones, thank you so much for joining us
let me
on.
let me say one more thing about the book. Right now, through the end of this month, which is not very much longer, we're doing a giveaway. Just so whoever's watching this, whoever buys the book and sends me a DM with the receipt, will be entered to win a MacBook.
Oh, well, y'all better go ahead
So
and
it's pretty
buy your
live.
book. Yeah, go buy your books. I'll
MacBook.
be sure to put that on there. It's in her link. I mean, it's in her bio as well, and it's in her stories every day. It's in her story, so you can go
Get
and
your
get the link.
MacBook. $15. You could win $1,000 MacBook.
And it's amazing, and it's a very quick, easy read. And that was what I appreciated too. It was a really good read because it was quick and easy. I got enough books I'm reading right now, but it was a really good read. So I appreciate both of y'all. Thank y'all so much. If y'all have any other questions, you can always DM me, and we can get the answers to you. I appreciate both of y'all for joining me on today, and I can't wait for the next conversation.
Thanks, Janisha.
Awesome.
We appreciate
You're
you.
welcome. You're
Bye.
welcome. Have a good night.